everyone. Looks like we are now live and we can start the meeting.
Thank you, Angelica. Good evening, everyone. My name is Ashley Trainum Carson, and tonight I will be moderating the information session about the proposed emergency shelter at the Ramada Inn. To start, staff will be providing a brief presentation, and then we will open up the caller line for public comment. First, let's do a round of introductions for our city staff that are joining us tonight. We'll start with Nikki.
Hello, my name is Nikki Reed. I am the Interim Director for the Community and Economic Development Department.
Hi, my name is Kathy Ball, and I work in the City Manager's Office for the City of Asheville.
And I'm Emily Ball, not related to Kathy Ball, and I work in Community Development at the City of Asheville.
Hi, I'm Brad Branham. I'm the City Attorney for the City of Asheville.
Good evening. I'm Angelica Driver. I'm the Administrative Assistant for the Community and Economic Development Department.
Thank you, team, for those introductions. We're going to begin our presentation and we're going to kick it over to Nikki.
Great. Thank you so much. So tonight we're here to talk about the emergency shelter. So thanks for joining us. To get us started, here's a brief overview of what we'd like to cover for the presentation. We're first going to have Emily talk about homelessness in Asheville and really help us understand the current status, current situation. And then Kathy's going to walk us through some of the vision for the emergency shelter, and I'll talk about process. In the end, we're going to answer some questions that we've received through email, and then also open up our phone line and have a discussion with community members and hope to answer their questions. So again, thanks for joining us, and we look forward to this discussion tonight. And with that, I'll turn it over to Emily. And so Emily, just let me know when to advance your slides.
Great, thank you. Go ahead to the next slide, and thanks to all of you for joining us tonight. When we think about homelessness in Asheville, our role at the city is really to take a systems approach and looking at homelessness as a really large community issue that impacts every sector of our community. Our job at the city is to be sure that we have an effective mix of services to best serve people experiencing homelessness in our community. We want to be sure that we have a good mix of crisis intervention services as well as permanent housing services. We know that homelessness is ultimately a housing issue, and we have to stay focused on exits to permanent housing from any intervention that we develop. Most of the folks who are homeless in our community are really well served by the strong service providers that we have. We have a really robust service system in our community, great nonprofits that are providing really effective emergency shelter and transitional housing and permanent housing to folks who are homeless. And we also have a subset of people who need a different type of intervention and continue to be unsheltered. And that means that they are staying outside, that they are on the streets, they are camping, they might be in a car. And those folks typically have more complex needs than people who are staying in emergency shelter or transitional housing. You all probably are familiar with this, but every year we conduct a point in time count, which functions as a census to identify all of the folks who are experiencing homelessness on a single night once a year. In our 2021 point in time count, which happened in January, we identified 527 people who were homeless. 411 of those folks were in shelters or transitional housing. So again, the majority of people really well served by programs that already exist in our community. 116 of those folks were unsheltered, so on the street, and that number is almost double the number of unsheltered people that we saw in the 2020 point in time count. Next slide. We certainly attribute a significant portion of the reason that number doubled to the pandemic. COVID has been very difficult for our community, very difficult across the country and across the globe, and really had a disproportionate impact on folks who are homeless. So in the 2020 point in time count, we had 65 people who were unsheltered. 2021, we had 116 people who were unsheltered. So really significant increase in that time. We also are seeing an increase in mental health needs, an increase in substance use. Our community and our region have been very hard hit by the opioid epidemic in particular. And we know that there is currently an increase in requests for crisis services. So a large number of people who are reaching out for emergency support because they are currently in crisis. because of all of that, we are recognizing the need to develop a new intervention in our community. Again, we want a full community approach, a systems approach, where we're really continually evaluating the mix of services that we have in our community and adapting as the needs evolve. And what we have identified right now is that we have an emergent need. We are in a crisis situation in our community, and we want to be responsive to that need. Next slide. Our goal in developing this intervention is to decrease the number of people who are unsheltered. And I want to say again that ultimately our goal is to end homelessness. We continue to stay really focused on exits to permanent housing. We want to keep a housing focus in every activity that we conduct. But specifically here, our goal is to bring people inside. It is not safe for people to be outside. It's not safe for them. It's not safe for our community. And so to decrease unsheltered homelessness by developing a new and targeted intervention. Often the reasons that people are unsheltered include that they lack identification, that they are not currently clean and sober, that they want to stay with their partner. Most shelters are divided by gender. Often folks are not able to stay with their partners, that they want to bring their pets with them, and that they really struggle in congregate settings. A large environment with a lot of people who are also in crisis can be a really difficult environment for people. And so what we've seen in our professional field in the last few years and across the country is a real shift around the approach in delivering emergency shelter. So we are identifying the reasons that people are unsheltered and working to really address those reasons, to remove those barriers so that people are able to come inside. Doesn't mean that we have a particular structure. It just means that we take an approach that encourages shelter entry, again, recognizing that shelter is a safer environment for people who are experiencing homelessness than being outside. And with that, I will turn it over to Kathy.
Kathy, you're on mute.
Thank you. Thank you. It takes a team, right? So I'll be talking more about the vision for the emergency shelter. Emily has touched on a lot of these points, but we kind of want to say that we took the time to kind of walk through what we thought in working with our community members and folks who have provided homeless services on what that vision would look like. Nikki, if you'll go to the next slide. So as Emily mentioned before, we wanted to develop a new emergency crisis shelter specifically designed to engage people who don't or can't access other programs. We want to decrease barriers to entry, screen people in as they are. So that would be a high access to a crisis facility. We want to be inclusive. We don't want to screen people out based on their demographic characteristics, but screen people in. But we want to ensure a healthy, high-functioning operation with safety-based rules. So that's an important component about the vision that we have, is that no one is screened out, but once you're in, you are provided with healthy, high-functioning operation and with safety in mind as a key component. We also want and have a lot of care providers in this community that help our community who are in crisis. And we want to create a location where they can come and meet people where they are. So bringing people on site to this location so that they're able to provide services to this group of our community is really important to us. But we can't overemphasize the last one that we have, which is to focus on exit to permanent housing. The ultimate end goal with everyone who comes in is to help them find permanent housing. So this is the vision that we've put forward. Next slide, please, Nikki. Why now? The pandemic, and most folks would acknowledge this, the pandemic has heightened and highlighted the crisis of the homelessness. Not only the pandemic, but the opioid crisis has as well. We have experience in doing this. We have, since the pandemic, worked on providing shelter for our homeless population that are most vulnerable during this time. We first started out with a congregate setting at the Harris Center, and then quickly were able to pivot into a non-congregate shelter at the Red Roof Inn. So from June of 2020 till June of 2021, we were able to house people at the Red Roof Inn, and had a great deal of success, with over a third of those folks entering into permanent housing. Then we had, in the spring of this year, 2021, we had a large group of folks who were affected by the pandemic and or other crises that were going on in their lives, who were camping in public parks and were camping in large groups. We had a lot of concerns about that, not only for our residents and the folks visiting the parks, but also for the folks who were camping there. We were getting a lot of calls for service to the police because of problems within the folks who were camping, as well as other problems from the community. At that point in time, we started looking for other options that were safe and would keep our homeless population safe. And we were able to identify a location of the Ramada Inn to be able to house folks to. So we literally, around April, started moving folks from various encampments in the city into hotels. And one of these hotels was the Ramada Inn. We do have a new federal resources that provide an opportunity to help us fill this long-standing gap in community service that these folks need. We hope we've identified in this presentation the importance of the non-congregate setting and what it brings to folks who have that need to be in a separate room. And so this opportunity came forward to us at the same time. So Nikki, if you'll go to the next slide. So this would target the population of people who would otherwise be unsheltered, or in Emily's presentation, those that are unsheltered with the point in time count. The location would have a minimum capacity of 110 beds. Most of these would be non-congregate space, which essentially says they would have their own room and have one household per room. There would be a limited number of spaces available for crisis referrals from law enforcement, EMS, and hospital. This would help with jail diversion, as well as folks who don't need to go to the hospital to be able to have access to care within this location, but then be able to get their needs met. We're focusing very heavily on wraparound services for these folks who are in crisis so that they can become stabilized and get connected to care on site and have positive exits to permanent housing. Next slide. And now I'll ask Nikki to talk about the process.
Thanks, Kathy. So when we think about the city's role, it really relates to the city's role in leadership and in convening the discussion and also acting as a funder for these important services. The city is not a direct service provider. So really through this process and through this structure, we are seeking a partner. We want to partner with a direct service provider who will actually be the operator of the shelter. And what we anticipate is that shelter operator would include 24/7 staffing. So they would have intake for people coming in. They would supply those basic services. You see here we have food, laundry, linens, etc. There will also be 24/7 security on site. And the wraparound client services, as Kathy mentioned, really bringing those services on site so that people have access there at the location, as well as doing data collection and reporting so that we can share on outcomes and how this is improving the lives of people in our community. With that, there will also be other service providers, and the city will act to coordinate those details and to coordinate those agreements with those partners to provide additional services. If you recall, on Monday, we had the panel discussion with Goodwill Industries. They do local job training, local job placement, resume building. They've been an active partner with people who are at the Ramada now, and we expect that kind of partnership to continue here with other service providers who will also bring together the medical care, the behavioral health care, and other services that can really help to stabilize people and provide pathways to permanent housing. And the city will continue to act through ongoing oversight and support with this shelter. And so when we look at that shelter operator role, the way we're getting there is within the framework of city process. So the city issued a request for proposals, or as RFP as we say, and that request for proposal asks shelter operators to describe their approach and philosophy, because we want to ensure that it does align with the vision for this site. We want to know about their experience with shelter operations and what kind of populations that they have worked with in that experience. We want to ensure that that's a key component of the operator. We also want to understand their organizational capacity to ensure that they can bring the resources needed, the human resources there to work with clients who will be in shelter. We also want to understand their plan for managing the facility, the upkeep, the cleanliness, the janitorial, et cetera, really to keep the property in good condition. Also, the budget will be a key component. And we're also asking for letters of support so we can understand the history and those references that will be key in that final decision of who will operate this facility. And then we'll also be talking about this operational plan. And this plan will be developed in partnership and collaboration with the city and that operator. There's certainly a lot that needs to be figured out and a lot of procedures and policies to be put in place, but it's going to be based on key elements, including eliminate those barriers to access. And as you know, Emily, and really try to paint that picture of why that's a key component here with the shelter. We also want to understand the staffing plan as well as the training plan for those staff members. And based off the approach that Emily talks about a lot when working with the specific population, it's very key to have good training so that people know how to de-escalate and be responsive to the needs of people in crisis. That's a key component for really increasing the safety on site. That flows right into that safety and security and how all that will be planned together and managed through the shelter operator role. We also want to get feedback from the participants to really understand what can be improved, because that's an important model with everything we do, is that continuous improvement and getting the feedback that you need to make that happen, to really make improvements and ensure that we're right-sizing this operation and providing the right intervention for people who seek shelter. We also will have a plan and have support resources for those successful exits to housing, and that is a primary objective of the shelter. And also a plan for maintaining positive neighborhood relationships. It's that personal relationships with the neighbors, understanding what can be improved, listening to concerns, and responding to those in concert with the city as well. In discussion around timeline, so the city issued that RFP. It's posted live on the city's bid page now. We published that August 6th. And then upcoming, the Asheville City Council will review and vote on the funding for the property acquisition on August 24th. So that's later this month. We do expect to receive the RFP submittals. So that's submissions from potential shelter operators. We expect to receive those on September 17th. And then through that, we will look through those proposals and deliberate on the best qualified proposer there, with a contract hopefully to be awarded in October of 2021. We'll work on those details that we talked about earlier to finalize that operational plan together. And then we anticipate operations to begin in early 2022. So you see this timeline and you see this sense of urgency, but it's really in reflection to a crisis response, as we've talked about earlier, with the crisis of both the pandemic and the results that we're seeing there, as well as the opioid crisis, and really hoping that this intervention is at the right time for our community within the respect of what we're experiencing now. So we are ready to turn it over to questions and answers. And I think what we wanted to do before we open up the call-in queue is we did have emailed questions. We continue to receive emails. And so I think we wanted to take a minute and review some of those questions that we've gotten via email and see if we could address those, and then we'll turn it over to the live calls. And so with that, we did create a slide to capture just some of the things that we've heard. And again, we continue to receive those and reflect upon those. But I think we'll seek to address those right now. So let's go here. So please explain exactly where the term low barrier came from. And I think, Emily, you're in a good position to answer that.
Great. I do think that we've had a lot of community discussion about the term low barrier, and we've had a lot of community confusion about the term low barrier. So I appreciate having gotten this question. The idea of low barrier is really, really, really related to access. So it means that if you think back to that earlier slide about the reasons that people are often unsheltered and don't come into shelter, all of those reasons are barriers to access. And so the intention with a low barrier approach to service delivery is that you identify what those are and change them. So some barriers to access include not having state-issued identification. That is a major barrier for people to access much of anything, a major barrier for people in seeking employment, in seeking permanent housing, and in seeking shelter in our community. Another significant barrier that we see often is people who have a partner and want to stay with that partner. They feel safer with that person. They don't feel comfortable separating at shelters. And another is people who are not clean and sober. It just is a reality in our community that we have a lot of folks who are not currently clean and sober, and therefore not able to access the care that they need. And so that creates a barrier for them in getting into shelter. I want to really emphasize, though, that low barrier does not mean that once people are in, we don't have any rules. Low barrier is really specifically around access to services. Once people are engaged in the shelter, they absolutely have to be able to participate safely in order to continue to participate. So any shelter will have to have safety-based rules and have to have a safe and healthy environment in order to be successful. That's a high priority in this project.
So I think this next question we'll pitch to Kathy. So how is this different from what's happening at the Ramada right now?
Thank you, Nikki. So the way that I would answer this question, and I'm thinking that whoever sent it in was asking, how is the low barrier shelter in our vision or the high access emergency crisis shelter different from what's operating? The folks that are at the Ramada Inn now were all a part of a group that were in different encampments and parks back in the spring. So this we have not continued to allow folks to come into the shelter until we are able to move forward and make sure we can provide appropriate wraparound services. The business now is continuing to operate with customers coming in. So there's a limited ability to be able to control access into the site. There's also, we have also proposed that as this project moves forward, that we are able to put into place measures such as fencing, controlled access, lighting, higher levels of security cameras that would provide for that safety once someone comes into the site. So that is not currently happening at the site because of the nature of the way the business is being operated. And have I left out anything, Emily, about the way that it's operating currently?
I'd say that two other big pieces. One is all of those things that Nikki went through about requirements in the RFP submission from a prospective partner. Those are all things that we don't fully have in place at this point in time. And the other is that we don't really have the ability right now to bring in other services on site. We do have Goodwill operating on site, and that's been a really great partnership. Sunrise has been on site providing peer support services and overall management there. And that has also been really effective in getting people connected to treatment in particular. But I think part of our vision in the future that would be different is that we would have the ability to coordinate just additional care for folks who are staying on site.
So I think I'll try to answer the next question here about why did the city choose this location? Why is it not downtown? And so I want to talk about that. So first, let's talk about zoning. So the current zoning is regional business, and we were able to clarify that a shelter is a use by right in that zoning district. So it does conform with the current zoning. The second thing is that it is in close proximity to services such as retail, pharmacy, et cetera, which is a place to have your needs met and buy food, or could be a place of employment. And so that was another good reason. It's located on a transit line, so accessibility was key, and having low-cost transit options is important. One of the other pieces is that it's move-in ready. So this current hotel can be used as a shelter with minimum upfits. The acquisition of this property does include the furniture and everything included on site. So that does mean that it can be up and running with minimal upfits as a shelter. That's important, again, when we talk about crisis and the ability to respond now to this need. Other details, such as there is no elevator on site. So when we think about long-term maintenance, it's really nice that it's a 2-story walk-up on the property. Also, the interior rooms are accessed off of a hallway. So that provides us options with respect to security. The vacant parcel on the site, so it includes 2 buildings as well as a pad, offers opportunities for new construction. Is it additional rooms? Is it offices? Is it a potential for a future change of use? So something like permanent supportive housing. So when we think about acquiring property with the city, we think about that long-term perspective and the importance of looking at a real property and its uses that could occur. And so looking at those options are important, and understanding that flexibility is important when making a strategic purchase like this. And also it's right sized. When we think about what Emily said earlier about the number of unsheltered people in our community right now and the number of rooms that are proposed, we feel like this is the right sized and right priced intervention that is needed at this time. And so with the idea of why it's not downtown, I mean, when we think about the way that this is structured with services being provided on site, we do believe that the concept is really bringing that to people where they are. That's really what we mean by that, is bringing services to where they are in their personal life and in their personal journey, but also where they are in place. And so having people with their own room, having that stability and that integrity of having your own room, but also having services where it's not as if you're having to go out to all these different places to get your needs met and to really find that pathway out of homelessness, but those services are brought in-house. So really it could be at this location without necessarily having to be co-located in another place. So, okay, I think this next one talks about safety. So why don't we ask Kathy to weigh in on that? How will this affect the safety of neighboring properties?
Thank you, Nikki. I want to point out a couple of things about this location as well. When we started looking at the encampments that we had in the city around the spring, it just so happened that we had a very large encampment in close proximity to this location. So when folks were camping in a park adjacent to this property, we had an extremely unsafe situation for the campers, those that were unprotected by camping at night, as well as the surrounding property owners. So essentially the same folks who, the same location where we are considering now were affected by the encampments that were going on. One of the things we did when we looked at this property, we have certain practices and principles that the police department are certified in, and it's called crime prevention through environmental design. And so some of the things that I mentioned earlier about having controlled access, improving lighting, being able to have fencing, doing other things at the property, having cameras, they're all ways that the property can be designed in order to keep it safe for the folks who are on site as well as for the neighbors. You know, one of the things that's really important is to be good neighbors to all of our community, and that is one of the things we focused on. And in doing the project planning for this property is one of the first things we would want to do. And we've also looked at ways that we could construct sidewalks so that we could encourage and keep people off private property so as to lessen the impact to adjoining property owners. So we feel like one of the whole purposes of doing this is to make the whole community safer and to help people who are in crisis. And being able to shelter them and provide the services they need in a safe environment is is actually making the whole community safer.
And I think one of the last questions that we pulled from our emails was, what about people who choose to be homeless?
I always love this question because I have worked on homelessness a long time, and it's always been my belief that people don't choose to be homeless. I think you can't walk into a second grade classroom anywhere in the United States and say, who wants to be homeless? When you grow up and have a single child raise a hand, it is not the goal for people to end up there. People become homeless because they experience a crisis. They don't have enough support in that crisis. They don't have any other options. And so they end up on the streets. And folks who are homeless often have really severe histories of trauma. Just if you think about all of the things in your life that would need to go wrong before you ended up sleeping in a park in the city of Asheville, those are the things that have happened to people who were sleeping in parks in the city of Asheville. And so what I appreciate about this question right now is that our experience with this particular project at the Ramada really sort of substantiated what I have always believed to be true, because when we went into those 3 camps that where we were offering folks the opportunity to move into the shelter option, 100% of the people that we talked to said yes. So I think we have had this really longstanding narrative in our community that people want to be homeless, that some people are choosing to be homeless, that people are offered shelter and they decline. And that is true. And that is because we haven't had the type of shelter available that best meets the needs of this particular subset of the population. So that's really our goal, again, in this project, is to develop that type of intervention. But I do believe the onus is on us as a community and as a homeless service system to really identify what people need and be responsive to those needs. And so it's been really heartening to me in this experience that when people have had the option to come inside, they have chosen to come inside.
Great. So I think at this point, that was our highlights from our email questions. We did want to now open the caller queue to begin the live discussion. So I'll turn it to Ashley. Thanks, Ashley. I'll turn it over to you.
All right. Good evening again. We're going to start our calls, and I just wanted to, we're going to turn it over to question and answer section of the meeting. We have received email questions and have asked callers to register in advance to ask live questions. Callers are given 3 minutes to share, and we ask that all callers follow the rules of decorum. If we have time, staff will answer questions we receive through email. We are only taking calls from individuals who registered. If you're on the call now is the time to enter the speaker queue. Call 855-925-2801. Once again, that's 855-925-2801, and the meeting code is 4928. Your phone will be muted, and you will hear the meeting is now live. At this point, callers will hear, for more options, please press star. Pressing star 3 will allow callers to listen live and join the speaker queue. Once again, you will have 3 minutes to speak. Our first caller this evening is Emily M. And I'm going, hold on. Sorry, staff. It looks like we lost some callers. Let me refresh. Okay, our first caller is Emily M. Stand by. Emily M., your phone line is now open. You can start your comment or question.
Can you hear me?
Yes, ma'am, we can hear you.
Okay. Hi, everyone. My name is Emily, and I work out about 4 times per week at the River Ridge Shopping Center, which is near the proposed shelter site. I'm calling to say that I support the low barrier homeless shelter. I want to thank everyone who's worked on this project for their efforts. I think you're all working on something great. I also want to say thank you for addressing a lot of the questions I emailed in your presentation. So sorry if I repeat anything you already said because I read this before I saw the presentation. So since hearing about this project, I've done some research into what a low barrier homeless shelter is. I think the idea is somewhat misunderstood by members of the community who think that a low barrier shelter means that the shelter will not have other services such as employment services, mental health services, and physical health services. From doing research on these shelters, listening to the informational session you held on Monday, and reading the RFP put out by the city, it's clear to me that the city intends to provide these services along with housing. I would like to ask that the city make more of an effort to communicate that to the community and the businesses near the proposed shelter. The idea of a low barrier shelter is particularly appealing to me because it leans away from the idea of treating people with addictions as less than human. While I haven't done much research into the statistics, I personally have seen people I know who have been previously clean for years relapse during COVID. I assume this is due to the isolation brought on by the need to quarantine. In fact, my best friend relapsed and passed away in November. It is my understanding that a low barrier shelter does not require people to be clean and sober to enter, but that it also does not allow drugs or alcohol on the property. I think that is great because I do not think that people fighting addiction have as much of a chance to get clean while they are unhoused. I believe that we are all created in God's image, and I do not think that having an addiction means someone is less worthy of housing, respect, and love. A low barrier shelter that will not turn people away for drug or alcohol addiction embodies this idea. I also want to say that I don't know any statistics for our homeless population on addiction, but I do feel that many people make a snap judgment that addiction is the only reason for homelessness, and it's not. It's just the one I chose to speak about because it's an issue that's very close to home for me. I do know from discussions with other people that one of the concerns of the surrounding businesses is that people may choose to use drugs and alcohol right outside the boundaries of the shelter property and then go into the shelter. This could cause increased litter on the property surrounding the shelter. And I would like to ask the city to respond to this concern so that these businesses can have more confidence in the project. Thank you again for all your work on this. I look forward to seeing all the good this project will bring.
Thank you very much, Emily.
Ashley, if I could just speak to two things that Emily said. I appreciate the comment about making sure that we communicate better about the wraparound services. So it sounds like we were getting good feedback about parts of this project that maybe we haven't communicated. So we will take note of that. And I wanted to just notice that. And we will take note to say we have been, the provider that we have on site now has been walking around and trying to pick up litter on adjacent sites, and we will continue to do that. And it would be a requirement in working with an operator that they work with the adjoining property to try to make sure we pick trash up. So I appreciate the opportunity just to address those two issues.
Thank you, Kathy. Our next caller is Katarina T. Katarina, your line is now open.
Hello?
Yes, we can hear you.
Okay, great. I'm pretty concerned about a few things I heard in the previous meeting. I'm sorry about the dogs. I heard that in order to keep the adjacent properties safe, that you guys are planning to build a fence around the Ramada. While I understand the importance of keeping people safe, I also feel that brings down the comfort level, because it was spoken about that in order to recover, that people need to be comfortable. But once you begin building up barriers and walls, it feels as if you're being treated as a different human, like you're not really being treated the same as, say, your neighbor who does not have to be caged up, if you understand what I mean. I'm also wondering how this will affect those who, say, are sober. From what I understand, this is a homeless shelter and not a drug rehabilitation shelter, while yes, there are people who do use and there will be services provided to help them recover, I'm concerned about, will this only be for those who are trying to recover, or will sober people be welcomed? Will they be treated differently, or will everyone be treated like an addict that needs to be locked in a cage? I understand that this is not the intent of the shelter, but I think this is how it can be coming off. I work up there with quite a few people, and already they're saying, well, if they're going to put me in a cage, I'm going to leave. Because people, they feel a lack of freedom when they need to be checked in and checked out. It really brings down their morale. They don't feel like they're going to be treated the same anymore. And I think it needs to be addressed. And there's also a lot of children out here on the streets living in cars and tents. And I feel that if this is an emergency shelter, that children and the elderly and disabled also need to be brought forth as an immediate importance that needs to be sheltered first. That's all I can currently think of on my mind right now. Thank you so much for listening to my concerns, and I hope that everything can be situated where the entire homeless population can be contributed to, and not just those that are struggling from addiction.
Thank you very much.
Ashley, can I speak quickly? I will try to speak quickly to this. And then maybe if Emily or Nikki, we would propose that it would be a decorative fence. We have had conversations about not wanting to put in fencing that would resemble something of a penal standard, but more of something that looks decorative, maybe comparable to what's at the VA. So we have had discussions about trying to make sure people don't feel like they're imprisoned. I also want to point out that this is, the vision for this is a shelter for all. I will tell you that in my experience in working and helping some of the folks who were at the encampments move into this location, there were a lot of folks who did not have addiction issues. And so some of them were just a couple who had gotten down on their luck and gotten a couple months behind and couldn't afford to stay where they were at. So everyone would be welcome, because that's one of the barriers, is that nobody would be screened out based on what kind of crisis they're facing, and that the services provided would meet the needs of the folks who are coming in. So I just wanted to point that out. I don't know if any of the other folks on the panel would add anything to that.
First of all, thank you for those questions. I think those are really, really thoughtful questions. I want to say about the fence that the idea is absolutely not to restrict the freedom of people who are staying there. It is certainly not intended to be a barrier for those folks. What we do have to have is a way to ensure we know who's on the property, and that we don't have this kind of wide open access, which is the current state at the Ramada. There's not a way to know who is coming off and onto property based on the current configuration. We do have to have that in order to ensure that we have a safe operation, and that safe operation supports the safety of the people who are staying there. So we know from national data that people who are homeless are more likely to be victims of crime than perpetrators of crime. We don't want to create an environment where folks are susceptible to drug dealers and other predators who might be coming on property to try to connect with that population. So the goal of the fence, again, is really to ensure that we have a safe operation inside. It's not to restrict the freedom of folks who are staying there. And the other thing I wanted to say is that something that's been really wonderful for me to see in this project is the real effectiveness of non-congregate shelters. So having the ability to have people have access to their own space where they are safe, and their household or they as an individual are safe in their own space really promotes a lot of safety, but it also gives us a lot of flexibility in terms of who we're able to serve. We do envision that this project would primarily serve adults, but because it does have that non-congregate flexibility, we would have the opportunity to serve folks who really have no other option. Today I was in a conversation with somebody who is trying to work with a dad and a 7-year-old and is unable to find a location where those folks can be in shelter together. And my other example of this is we have had some folks at the Ramada. We've had two people at the Ramada who were pregnant. One has already had a baby since she's been there. We certainly would never want to ask that mom and her new baby to leave. We want to have that flexibility to serve people who need to be served. So that's the real value to me of a non-congregate shelter.
Thank you. Our next caller is Eden Matthews.
Hello.
Yes, we can hear you.
Yes, I appreciate this opportunity to hear the plan and to see the passion that all of you have that have spoken about this project. I'm someone who lives at River Ridge Apartments, and I'm on the high side of the hill. I'm literally just over a hill from the Ramada Inn. I walk a lot. I've lived here since October, and I include the Ramada Inn in my route. And I can tell you that although in theory I'm supportive of what y'all are trying to do, as someone who lives right here, I'm very concerned about the impact, the continued negative impact that it's going to have to this community. I've seen things, I've seen an increasing amount of negative things as I have continued to walk over the months around River Ridge Marketplace. And there is traffic through our property here on a continual basis now. I've witnessed illegal drug use around the mall. And I do think that I speak for a lot of people who live over here. We're very concerned, and I'm sure our neighbors at Verta Vista have to be very concerned as well. We have seen the mall start to come back from COVID. There's new businesses going in. Of course, you realize that, and you realize J&S is about to reopen. And I would imagine that this is going to not be a positive for them. A lot of elderly people eat at J&S or used to eat at J&S, as I'm sure you're aware. And I think that it's going to discourage them from patronizing that restaurant when it reopens. So I don't have a question. I just wanted to make sure somebody on here presents those concerns, because there are a lot of people that live in these two large apartment communities that are literally right up against this property. Thank you.
Thank you. Did anyone want to respond to that comment, or can I go to the next caller?
Well, I think, Ashley, this is Kathy. I think there wasn't a question there, but I think we do want to acknowledge and hear the concerns. I do want to speak to the fact that, unfortunately, given the COVID crisis, the increase in the homeless population, as well as the opioid epidemic, has unfortunately caused a lot of what Eden was speaking to occur throughout the city. It doesn't make it any less impactful to those neighbors. I also want to point out that in thinking through the safety measures that we've talked about implementing, we would, the goal would be to reduce the impact on those neighbors that they're currently seeing. Thank you.
Our next caller is Tamara Pearson. Tamara,
hey,
your line
good
is now
evening,
open.
everyone. Thank you. Good evening. My name's Tamara, and I'm actually the community manager over here at River Ridge Apartments. I just want to open up with a statement stating that we're completely neutral regarding the city's potential purchase for the Ramada Inn. But with that being said, as our previous resident stated, we do have some concerns that we do want to share with the City Council. Since April 2021, we've noticed a large increase of loitering near dumpsters, trespassing in the woods areas along the community property line. We've had about 4 abandoned camps with needles remaining on the property. And then most recently, we actually just had our community car wash was completely vandalized. And also, we also had about 8 car break-ins just between May 2021 and July. That's basically it. We just want to inform you guys of the issues that we've experienced since the beginning of April.
Thank you, Tamara.
Thank you.
Our next caller is Sarah Wilcox.
United Church of Christ, and I want to offer a deep gratitude for the work of the city in this time. I have sat at the tables in which people have spoken about this. There has been input that has been asked from community leaders about how we move through honoring the human dignity of the folks in our community who are without homes. And one of the known needs is some type of low barrier shelter that helps people who have some of the greatest needs. This serves such a deeply important need, particularly in this time. Using the ability to partner with service providers and organizations is vital, because oftentimes our service providers have lots of abilities. They just don't have the resources to help people without resources. So the city becomes a way to connect the service providers to the folks who most need it. I want to name that there are many needs and many solutions, and this is not just one solution that will solve all the problems. It is a solution that will then be a part of the multifaceted solutions necessary to solve these problems. The actions of the city staff and the visionaries who have come to imagine this possibility have been courageous, they have been innovative, they have acted boldly, and most importantly, they have acted with deep intention around the humanity of every single child of God. I pray for you all. I offer my gratitude. I understand there are concerns. If we live in the what ifs forever, we will never move forward with the possibilities of what is needed. Thank you.
Thank you for your comment. Our next caller is Sandra Houts. Sandra, your line is now open. Can you begin again?
What?
Thank you. Your line is open. Can you begin again?
Can you hear me?
Yes, ma'am.
Oh, okay. Sorry, because it's hard to know. Yeah, the comments have been excellent. I'm very pleased with what you all have presented and the thoroughness with which you have designed this program. I'm really distressed with the kind of incidents that have occurred at River Ridge. I've read about them on next door, but that's very concerning. So I don't know how that's handled. I have comments, and I really am in full support of this. I just think it's absolutely necessary that we begin treating people with compassion and with real concern, and to give them a hand up. And but what happens? What happens if people aren't able to comply with the rules that are imposed, that have to be imposed for the safety of all the other residents, as well as the safety of the community? So what happens if they have to be expelled from the residents? Are they back on the streets? What then? That's something I hadn't really thought about. It's a concern. I did want to say that, and this was brought up by one of the city speakers earlier, that the COVID crisis, the opiate crisis, I think has been maybe a blessing in disguise. I've been around a long time. I was a young nurse when the state hospitals all over the country were being closed because people it was thought were being warehoused and people were there who did not need custodial care, but they definitely needed the care of the assistance to manage their illnesses. They were supposed to be provided with community services, and obviously those community services nationally, as far as I know, never came to fruition. So I think this has definitely brought to everybody's attention the tragic injustices that have resulted from that lack of community services. And I'm so happy to see that it's recognized and that the plans for these shelters is including those necessary services in order to help people manage their illnesses, manage their needs. And of course, there are lots of other reasons for homelessness, whether it's trauma, all kinds of trauma, whether it's medical bankruptcies, whether it's evictions, whether it's loss of jobs, minors and adults escaping domestic violence, so many kinds of things. And all these people obviously are going to have to live together in whatever environment is presented for them. And it's a huge challenge, and I'm just in full support of it. So if there's ever a need for volunteers to work at any of these facilities, believe me, I will be right there volunteering. So thank you so much for everything you have done and for the not-for-profits who have been behind it all the way. Thank you.
Thank you.
Ashley, I'd like to respond to part of that. Thank you so much for your comments and for your support of the project. I wanted to answer your question about what happens when folks are asked to leave. I want to say again that safety is extremely important to us. It is paramount to the success of this project, and as such, we will be sure that there are rules that folks need to comply with. And we know that people are in crisis, and they're not always good at complying with rules. That's true of all of us when we're in crisis. So certainly, I would expect that some folks will be asked to leave. It's critically important that they have the opportunity to try again. I think that's a major component of the low barrier approach. We want to be sure that people are offered second chances and third chances and fourth chances, as long as they can continue to do that safely. And so it will be the charge of the shelter operator to really dig in with that person, to really work creatively with them on what's happening and how they can better support them and how they can ensure safe participation in the program going forward.
Thank you, Emily. Our next caller is Joe Rayfield.
Yes, hello, can anyone hear me?
Yes, we can hear you.
Yes, I know the safety of the residents and businesses and even elementary schools that's less than a mile from this property. I know safety and security is the paramount concern over there in talking to everyone involved around the site. And I know earlier, I know you said that security will be improved or that the issue will be solved by the time an operator is named in 6 months. Named and in operation in 6 months or so at the first of the year. But I read the RFP in its entirety, and when the operator is named, they will be operating under those rules set in there. And since it allows for no IDs of any kind, no sobriety or drug tests of any kind, and even allows people using the facility to check their weapons at night and retrieve them the next day, even after the thing's in operation by a professional operator, hopefully experienced professional operator, if this thing passes. I mean, how can security and safety be ever really addressed given those operating conditions? And I know the someone said earlier that knowing who's on the property once this thing is in operation is of paramount importance. Well, again, with no IDs being a policy, I mean, how in the world can you know who's on the property? And earlier, someone else cited Red Roof Inn being the success story to follow. But if you actually look at the statistics, crime did go up in the immediate area after the Red Roof started being utilized in such a manner. So I just wanted to bring those comments out, and that was it. And I thank you for your time.
Thank you.
Ashley, can I respond to that also?
Yes, ma'am.
Sorry, I keep jumping in. I just wanted to speak to your first comment about IDs and not requiring sobriety and weapons, and how can we ensure safety in light of those practices at the shelter. The thing I want to say about that is that all of those things you described, people not having ID, people not being clean and sober, people having weapons, those are true of people who are currently unsheltered in our community. So those are folks who are out and about in the community right now without the support that they need in order to stabilize. So really our goal in this project is to provide support to people to promote their safety as well as community safety.
Thank you, Emily. Our next caller is Stephen Carter. Stephen, your line is open.
All right, thank you. And I'm a resident of River Ridge and have been for the last 5 years. And so I've seen a good number of changes in the number of homeless coming through, of the type of homeless people coming through, and the increase recently that I'm not at all certain is due just to the COVID, but more to at least somewhat to the existence of the shelter that's at the Ramada now. We've certainly, as a number of people said, have experienced a considerable increase in small crimes, everything from theft of a motorcycle out of our parking lot here to car break-ins, to people wandering around and having to call the police because the people were clearly not in a normal state of consciousness. And I don't think that the things I've been hearing both earlier in the week and now really address most of these things. We know that there are different kinds of people who are homeless. There are different categories of homelessness. There are people who are homeless because they can't maintain themselves in a home because of some kind of addiction or some kind of mental illness. I'm very sympathetic with the person who talks about the loss of the state mental hospitals for this sort of thing. And then, of course, we do have the people, and it could be any one of us. None of us are all that far from being homeless in this economy. And these are people who need our help, and they need shelter, and they need all of the facilities and things that you're talking about. However, there's also a good number of other people. And I was a little disappointed in the point time count, which is discussed, occurring in January. In January, when most of the people who are homeless are going to be in shelters, otherwise they freeze to death and die. And many of them have left the area because over the years I've been here, and in years when I was here in the 1980s, a very similar thing. In the winter, people who are homeless and loose go to where it is warmer, like Florida. In the summer, when it is hot and unpleasant in those places, they come here to places like Asheville. So what the kind of statistics we need are, what is the population in the summer, in the spring, in the fall, not in January? That's not a useful, it's a useful figure, but not useful for our purposes. And so I'm a little disappointed in that. The safety that's being talked about, okay, so you put up a fence around the place, an attractive fence. Maybe it could have a nice slogan on it, like "Work will make you free." That was used a lot in the past, and we saw how well that worked out. I don't think that a nice fence is going to make anybody happy. It's not going to keep people in. It's not going to keep people out. If it's good enough to keep people in, or if it's good enough to keep drug dealers and the like out, it's a pen that keeps people in also. Let's be honest about that. However, it will not add to the safety of the community. It may add to the safety of the people in the facility, which is a good thing. But in the community, the people will be coming and going through the front door. If they become unacceptable because they're violent or they're using drugs inside or violating some other of the rules, then they're set outside. Where are they going to go to deal with their problems? They're not going to go far. They're going to go in my yard, in your yard, to the neighboring businesses where they sleep now. And is this what we want? I don't see anything that's being said that will have any control over that. And I think those are things that need to be addressed very strongly before we turn this Ramada into a homeless shelter of the type that's being talked about. Thank you.
Thank you.
I'd love to respond to the data part. I could talk about data around homelessness all day, so please feel free to be in touch with me. But I wanted to talk about the point in time count question in particular. So it is a HUD requirement of every community across the country to conduct a point in time count annually, and HUD gives us a window of time to do that. It's a 10-day window, and it is that time period every year. And so that's not a local decision that we make. We make our decision about when we conduct the count within that 10-day window, but that is a federal requirement for us as a community, and it's directly tied to some of the federal funding that we're able to access to provide crisis services as well as permanent housing services for folks who are homeless. We also manage a homeless management information system, so a database of folks who are homeless in our community and connecting with service providers. That's part of my role at the city. The data in that database is dependent on service provider participation, and some service providers are using funding that requires them to participate. Some are not and elect to participate anyway, but we are always working to improve our quality of data and our quantity of data in that system, because it is critically important for us to have a good handle on who is homeless in our community, what their demographic characteristics are, and what their specific needs are, so that we can continue to tailor the interventions available to be most responsive to the need.
Thank you. And I just want to give a reminder. Angelica said she got a few emails that people aren't able to access the phone line. The number is 855-925-2801, and the meeting code is 4928. You're going to want to hit star, and then the selection is 3 to speak. That's star 3. Sometimes wait a little for the prompt. So number, code, star, and then number 3, star 3. Our next caller is Beloved Asheville.
Hi, this is Reverend Amy Cantrell, and I'm grateful to be on this call with everybody that shared today. I just want to speak to some relevant experience from our work, particularly around the need for this shelter. We desperately need another intervention in our community that is low barrier shelter. I've been in Asheville over 20 years working with people on the streets. And it's one of the most devastating things that I continually see, especially with our street medic team, is we don't have an intervention. Finding people in single digit weather and having no shelter to take them to. We got a significant number of calls about a woman who was sleeping on a bus stop bench in North Asheville recently, and there was no shelter to take her to. I want to say that there are people who are living and experiencing homelessness throughout our city and county and every sector from Black Mountain to Candler, and yes, in Oakley for 20 years. So personally, during the pandemic, I spent time with a youth who had gotten kicked out of their home, who was camping in a shopping center in Oakley. I know people have camped on Wood Avenue in the woods for decades, multiple different people over decade periods of time. personally have found multiple families sleeping in their cars in parking lots, families of 5, families of 6 in minivans during the pandemic because they lost their housing, no shelter to take them to. And so we know, I liken this to having a medical center, a hospital that is a trauma center that doesn't have a surgeon or a surgical unit. That's kind of what we're dealing with, is that we have this very wide gap in our community where a significant number of people, due to no fault of their own, cannot access shelter. And it's literally heartbreaking. So we know that we need this intervention. I think that everyone is going into this with eyes wide open in terms of what we need to do to make this intervention successful. What we've said is we know that homes end homelessness, and we know that, and we're building homes along with lots of people in this community. But in the meantime, we need to not only provide a housing first option, but a shelter first option. We need to have shelter for everybody in our community. I was personally a part of a group of people that offered those hotel rooms to people who were camping, and saw that 100% of people said yes, because it does meet a significant need. I do believe that we're called to love our neighbors, and particularly our neighbors most vulnerable, particularly in the pandemic. But it also means that we are good community builders with the neighbors around this property and with the people that live there, so that this is a significantly positive experience for everybody. And I should hope that everybody involved will be that committed to making this something that really works for our full community. So again, I just want to say how much we need this desperately. We get calls every day of people on the streets. We see people on the streets every day with our street medic team with no shelter. And we know dozens upon families right now that are falling into homelessness because there's no housing for them to go to. This is a heartbreaking shame, and we can change that. And so I hope that we will do that as a city and commit to loving our neighbors who are experiencing homelessness until we all get home. Thank you.
Thank you. Our next caller is Judith Kaufman. Judith, your line is open. Judith, can you hear us? And she has exited. Judith, if you are listening, feel free to call back in and I will get you back into the speaker queue. Stand by so I can get our next caller. Okay, we're going to jump to Leela Allen. Leela, your line is open.
Hi, I work in community mental health, and I can totally appreciate we do need resources for homeless individuals in our community. And, part of my job is just working primarily with mental health and substance use issues. And, homelessness does certainly contribute to those things. And, vice versa. The other side of the coin is being a mom and a resident of River Ridge. I am concerned when we do find drug paraphernalia on our walks around the neighborhood or up to businesses, and I'm with my kids, and it is a safety concern. So my hope is that there is some security measurements being taken into place, and I apologize, I joined the meeting late, so I'm sure some of this is discussed already. However, it is a big concern for me, and I am aware of the similar project that was run over in West Asheville And I'm also aware too that crime did go up. So I'm hoping that when considering a new site for this, it's not just it's the whole community that's considered about what will make it truly a success. And I'm hoping, I'm glad that some attention's being drawn to the homeless population more so now, and hopefully the city can work out a solution that'll benefit everybody. Thank you.
Thank you. And I'm double checking our list for registered callers. Stand by. All right, we now have Jen Fox on the line.
Listening to my comments today. I'm glad you identified maintaining positive neighborhood relationships as an important criteria in your decision of whether or not you're going to purchase the Ramada Inn for appropriate use or for permanent use. I'm a resident of the River Ridge Apartments, and given the plan that you all have presented so far, I have to say that I cannot support purchasing the Ramada Inn as a permanent site. I do feel that addressing homelessness is an important goal, and I can tell that you're all trying very hard to find solutions to that. But as your presentation noted, operating a low-barrier homeless shelter is inherently difficult. It's a crisis-filled situation. It's very complicated, and it requires constant efforts and de-escalation. And with all due respect to your efforts to maintain a positive neighborhood relationship, enforcing safety and a code of conduct on the site, adding cameras and fences at the hotel, it's not going to protect the surrounding community. As another caller already mentioned, it just means that those dangerous activities are occurring in our community instead of on the hotel property. Our community is already seeing significant negative impacts from this use of the Ramada Inn, and having a permanent center with ongoing issues with safety and crisis management that concentrates the homeless population of the city right over the fence from me is not something that I want for my community. I'm a single woman who lives alone, and I was very careful in choosing where to live in Asheville. And I chose River Ridge because it did feel safe to me and it had a sense of community. Every evening I sit on my porch and I talk with neighbors who are out walking their dogs, enjoying the air. The people here care for each other. They keep their living spaces clean and tidy. They even warn each other of recent bear sightings in the neighborhood. It's been a welcoming, connected, and safe community. But since the Ramada Inn began operating as a homeless shelter, that sense of safety isn't there anymore. When I go out walking, I frequently see tents, discarded clothing, trash, broken bottles, and used needles in our community. I've been verbally harassed and received rude and threatening gestures when I was going to and from my apartment through the nearby shopping center. And as has already been mentioned, there have been break-ins, theft, vandalism, drug use, and trespassing in the apartments and surrounding businesses. I'm very sad to say I no longer feel safe in my community and in my home. And as much as I've loved living here, I don't feel I can continue living here if the Ramada Inn continues to be operated as a homeless shelter. And I've had friends who live in these two apartment complexes who tell me that they feel the same way and feel like they're going to have to move if this continues to be operated as a homeless center. I understand that the city is trying to address a complex issue, but at this point, it's clear that this experiment with the homeless shelter at the Ramada Inn is destructive and destabilizing to the existing community. A thriving community requires individuals who take care of that community, who build relationships with one another, who are respectful of each other in the space, and who are committed to bettering that community. However, the individuals who have come into this area with the homeless housing project have shown that they are not willing to invest in joining and building our community. So on behalf of myself and my community, I ask that the City Council find an alternative location for the homeless shelter in order to preserve and heal the community that I love and call home. Thank you.
Thank you. And we're just cross-checking the list to make sure we don't miss any registered callers. Stand by. We have Judith back on the line. Judith,
hi, can you hear me?
Open? Yes, we can hear you.
Yes. Can you hear me now? Okay,
yes,
thank you. And thank you for having this informational meeting. I'm impressed with the thought and the care that has gone into this project. I commend you on that. And I truly believe that we are all our brother's keepers. Each one of us comes to a place in life where we're in crisis, more or less. Some of us have more support systems around us than others, but it's good that Asheville's trying to help people that don't have those services. However, I really don't think that the Ramada is an appropriate place. Can you hear me again? Hello?
Yes, we can hear you. Please continue.
Okay. Yeah, I think that the Ramada is not an appropriate place for this shelter. It's too close to, really coming back shopping area, and it's very close to two densely populated apartment complexes. I would say that within the immediate area, probably a good 1,000 people are being impacted by this. And what's going on there now is very negatively impacting us. There's a trail down through the woods right into my backyard, and it's used both to come down and I don't know. I think sometimes escape the cops, which I've seen people do. Also bringing in, stolen grocery carts loaded with things, and those are carried up the hill. I don't know where those came from, but why they have to come into our area to transport them up through the backwoods. There are needles around. There are, I know of 2 or 3 stolen bikes, car break-ins, harassment. I could go on and on. I think you've heard this from other people before. And what I would request is you think of another area to run this project that is not so intimately tied to a shopping and dense residential area. Thank you very much for hearing my concerns.
Thank you. And I believe that's our last registered caller. Angelica, did you get the same? No more registered callers?
That's correct. I've been checking the list, but they may pop in.
Okay, so that was our last registered caller. We recognize that there are some callers on the line who wanted to speak. We only were taking people who registered in advance to have live public comments tonight. You're invited to still email us at avlendinghomelessness@publicinput.com. Once again, we only were taking registered callers, and you can still email us your comments or questions at avlendinghomelessness.com. Thank you. So team, that was, like I was saying, that was our last callers. We did receive a couple of emails during the meeting. Did you want to take an opportunity to respond to those? I can read one off that's been prepped for you.
Sure. If you want to read it, I don't know if we'll have a response, but if you want to read it, that'd be great.
Okay. This question is specifically about the RFP process and who or what body makes the decision on selecting the organization to be the shelter operator, who or what body makes decisions related to defining the outcomes and goals and how these will be reported. How does one get involved in these specific processes?
I can take that. We will have a selection committee. We're still finalizing the composition of that committee, but we will have a selection committee to review all of the responses, all of the proposals, and also to do interviews with the final candidates. Ultimately, that selection committee will make a recommendation to City Council for final approval, and we anticipate that occurring in October.
Thank you. And let me check these two callers that just jumped on to see if they were registered. Stand by. Nope, those were not registered. We don't have any more registered callers. So I'll hand it back over to Nikki or the team.
Great. Okay. Well, thank you so much, Ashley. Thanks for moderating our event. Again, we appreciate everyone for listening in tonight, and also for you that listened in on Monday as well. We really appreciate the conversation. It always means a lot to hear from our community, and again, just deep appreciation for everyone that's participated tonight. So, Kathy, Emily, any final thoughts, or do we want to just conclude with a quick reminder about next steps? Okay, so yes, so it looks like with our timeline, as we talked about earlier, our next step is Asheville City Council will be reviewing and voting on a budget amendment regarding the purchase of the property, and that is currently scheduled for August 24th. So again, we thank everyone for your participation tonight and appreciate. All right, that's it.
Thank you.
Thank you, team.